A very warm welcome to you, and thank you for joining us on Health and Wellness this Sunday and all the other Sundays at 6 p.m. to 7 p.m. right here on KTN. My name is Zaitun Ali, and on today's episode, we want to discuss about a topic well known to everyone, new moms, first-time moms, second-time moms, multiple, a mom who is a mom of multiples. Wanaitwenga hivyo, wale wa twins, Yes, so we want to talk about high blood pressure during pregnancy. And I know when I say this, kila mtu akili imeenda kwa preeclampsia. Today we'll get to discuss that and more of other conditions that causes high blood pressure during pregnancy. And joining me on set, I have Dr. Sikolia Wanyonyi. He is consultant of gynecologist and fetal medicine. Karibu sana.
Thank you.
We also have Becky Oteli, who is a preeclampsia survivor, and she's going also to share her experience about what she went through during her pregnancy. Welcome to the show.
Thank you.
And if you're watching, remember our engagement line is on WhatsApp, 0759-434389. Also talk to us on our social media handles at KTN Home _ on X and on IG. And on Facebook, we are at KTN Home. Also find me at Ali _ Zaitun on Instagram as well. And also courtesy of my dressing is Lugo Collections. Pale IG, Instagram, at Lugo Collections. They make amazing, amazing bespoke suits, both for ladies and gentlemen. So make sure watafute. Welcome to the show, guys.
Thank you.
Glad to have you.
Thank you.
Dr. Like I said in my intro, when you talk about high blood pressure, everyone clicks on preeclampsia, and it's what actually Becky had, which she's going to explain. But what other conditions cause high blood pressure during pregnancy?
So, as you correctly said, most of the time we think of preeclampsia.
Yeah.
But high blood pressure can happen in several conditions. First, you can have high blood pressure even before you conceive. So someone who's been on treatment for high blood pressure, so we call that pre-existing. You already had the condition, and then you conceive with it, and then either it worsens during pregnancy or it affects the course of the pregnancy. The other condition that we get is what we call pregnancy-induced hypertension,
Okay.
or sometimes in technical terms you may call it gestational hypertension. So that means that you are okay, you develop high blood pressure, but not necessarily, you do not necessarily fit into the definition of preeclampsia. So preeclampsia is the other spectrum. And the causes of this are just the causes of any other high blood pressure that can affect even pregnant women. So we are looking at things like kidney disease. We are looking at things like lifestyle measures, things that will actually make someone get high blood pressure.
Okay.
Yes.
And even as we're talking about high blood pressure, what is the gravity of this high blood pressure that probably a pregnant woman can get to now? This one has high blood pressure. What's the gravity?
No, any one who's pregnant, usually we do not want their blood pressure to go above 140/90.
Okay.
Of course, this may vary because in some people, maybe who've had originally very low blood pressure, getting pressures even to as high as 138, we may start getting concerned. But on a global scale, we are looking at 140/90. So any blood pressure above that is a concern. So I wouldn't say that we have to wait until it reaches a certain point before we say that now
This is it.
we are concerned. So we should be concerned at any blood pressure that is going above that threshold.
Okay.
Yeah.
And diving deeper into some of the risk factors, like you've said, a pre-existing one, probably you had high blood pressure before. I even hear others get high blood pressure even post.
Absolutely. Right.
So mention some of the risk factors that contribute to this.
So risk factors for high blood pressure during pregnancy could include things like maternal age. So those women who conceive maybe beyond the age of 40 are more at risk compared to someone conceiving at an earlier age.
Yeah.
And then it is more common in women who are having pregnancy for the first time. Then we look at lifestyle measures. So we're looking at, for instance, a woman who is going into pregnancy overweight or obese.
Okay.
Then things like smoking. Then we have other underlying conditions like kidney disease, heart disease that can make one be more prone to high blood pressure. Then we have history, family history. So maybe your first degree relative, your mother, sister, have hypertension, then you're more prone. So the list is quite long of the risk factors. So we tend to pick up this during your initial visit during pregnancy.
Okay. And even as we're developing this story, we are mentioning that Becky is a survivor of preeclampsia. So just lay the foundation to what preeclampsia is, and then now we get to hear her side of the story.
Yeah, so now going into preeclampsia per se itself, preeclampsia is high blood pressure. I'll give you a typical textbook definition.
Please do.
It's high blood pressure that develops for the first time during pregnancy, and usually that is above, beyond 20 weeks of pregnancy. So we are looking at around 5 months. And for one to have preeclampsia, one must have high blood pressure. And the other thing is that there is protein in her urine. So when we measure her urine, we find that there is more than, and there's a lot of protein above a certain threshold that we consider normal. So having those three, pregnancy above 20 weeks, high blood pressure for the first time, and then protein in urine qualifies for one to be diagnosed as having preeclampsia. And high blood pressure, I'm talking about 140/90.
Okay, that makes sense. Asante sana daktari. Becky, over to you. And I would like to know probably what your experience was like from the diagnosis to the treatment process, and even later on after delivery.
Okay, for me, I have had preeclampsia experience 4 times.
Are you serious?
Yes, 4 times. I lost my first 2 pregnancies to preeclampsia. Then that time I didn't have information about it. So the next, the 3rd and the 4th, we were able to get a doctor who was able to walk us through the journey. So in the first pregnancy, I was under 30 years. I was very young, just gotten married. And when I got expectant, I started gradually developed weight. I developed weight so fast. When I was getting married, I was 52 kgs. But at 20 weeks, I was already 76 kgs. 120. So I did not know what was happening. And my colleagues also thought, because I've just gotten into marriage, I'm having a very good time.
It's the happy weight.
Yes. So that was about the first 5 months. So I did not know I was going through preeclampsia. And then one day I just woke up and my face was swollen. So I was really so scared. I didn't know what to do. But I was working in a hospital. I'm a medical laboratory scientist. So I was working in a hospital. So when I went to work, the doctor looked at me and he just called me in his office and took the pressure check. When he checked the pressure, it was very high. It was 160 over about 110. What? Yes, so he immediately put me on treatment, antihypertensives, and he also gave me bed rest. But bed rest that he gave me, I was to go home to my place. And at that time, I was staying alone because my husband was working in the city while I was in the countryside. So I went in the house, expected to have a bed rest, but then I need to eat, isn't it? Yes, so I could not rest completely. But yes, I took the medication. The first day, I slept well. Waking up in the morning, I took the medication and just relaxed on the couch. And then a neighbor just came in to greet me and ask me how I'm doing. And I was okay. Just when he left, I went into anesthesia. I fainted alone in the house. So I fainted. He is out, the neighbor is out, but he did not know what is happening in my house. So I always say I had a guardian angel. I was living in a town in Western Kenya, so my sister was also staying in the same town. So my sister decided that morning just to pass by my house and check on me before she goes to work. So when she entered the house, she found me under the table. I had fainted. So she took the initiative and called an emergency. I was taken in the hospital, just where I was working.
Yeah.
And they really took the fast, they took me very fast. They acted very fast, checking on me, checking the fetal heart, and just looking at the expression on the doctor's face, I could see not everything was right.
Yeah.
So because the hospital was still, the facility was not very well equipped, I was referred to another hospital that had facilities. So I was referred, but then the baby had already passed on. So the baby was removed, and at least at 5 months, the baby was removed.
Okay.
At least I was not done CS, but at least the baby was just removed. I was just induced, and the baby was removed. So it really brought a lot of scare onto me. It's my first pregnancy. I'm wondering what is happening to me. I do not understand what the condition is. At that time, information is power.
Yeah.
That time I didn't understand what was happening. You hear so many things coming from people talking maybe what could be the thing. I did not understand. So I got scared for some time. I was so scared, even getting the next pregnancy, because I didn't know what am I going to enter into.
Yeah.
So I stayed for, that was 2014 when it happened, 2014 in October. Not 2014, 2004 in October.
Hiyo ni kitambo.
Yes, so I stayed 205, still scared.
Yeah.
And one thing that I did that I also didn't know, I was taking hormonal pills to protect me from getting pregnancy, which is not advisable for people who has pressure in pregnancy. So I stayed the whole of 205, 206 at the end. We made up our minds and felt like we can enter into this again.
Yeah.
But then we're entering into it, but we have not sought an expert's intervention.
And all this while, 204 to 206, did you seek probably a counselor or someone to talk to deal with the emotional challenges that you're going through at that point?
No, I was not able to seek, but I used to talk to my doctor. My colleagues that I was working with, they're the ones who just kept giving me hope and telling me that I'm still young, you can conceive again.
Yeah.
But then the information about preeclampsia was not, I feel like they did not know what they were supposed to be done at that moment about preeclampsia. So, in 2006 now, I conceive again towards the end.
Yeah.
Yes, so because of what I experienced the first, I talked to the doctor that we were just working with, my colleague, and he was like, I will be checking your pressure every day you come and every day you leave the workplace. So he kept the promise. He was checking every morning, and before I leave, he checked.
Yeah.
The journey was quite smooth. At around June, 2007 now, June, I just woke up. And again, a guardian angel again is the one who saved me. Because I remember it was a weekend that we had this holiday, 1st June.
Yeah.
Yes. So my hubby had traveled home and we had the weekend together. So when he traveled back in the evening, so I remained alone again. So in the morning I woke up, preparing myself. Now I was about almost 7 months.
Okay.
Preparing myself to go to work. So I prepared myself. I was taking some tea with some roasted maize. I had that. I really was craving for roasted maize. So I was there taking, and then my guardian angel again comes, my sister. I think she was so concerned.
Yeah.
So she just passed by again to check on me, see what I'm going, how I'm doing. So I told her I'm very okay. Don't be stressed. I am okay. I'm doing well this time. I did not experience that weight gain so much. The pressure was being checked, so it was not bad.
Yes.
So she said, then take your bag, we leave, we go together. As she goes to work, I go to work. So when I just took my bag, I just felt a pain across my belly.
Yeah.
Very serious pain, and I felt the numbness in my legs. I could not move. I didn't understand what was going on. So I told my sister, I don't know what is going on in my body, but I'm not okay. Then she said, but we have just talked now. I told her, it's not okay. So she came, held me. I could not even move. She held me, and she tried so hard. We called assistance again. I was taken to hospital. The worst part is that when you understand what is happening, I was looking at myself, and my palms were changing. They were turning pale. So, but there's no indication of any bleeding or anything. Yes. So we moved very fast, go to the hospital, and again, the expression in the doctor's face just showed that not everything is okay. So again, I was referred to the other hospital that I went in the first pregnancy. And reaching there, everybody was thinking I'm in labor. But to me, it was not labor. Because the steps of labor, I think for a mother, you will just understand it.
Yes.
So, but I'm looking at myself, I'm pale. So I'm wondering, what is happening to me? Remember, this thing happened in the morning, but now it arrives lunchtime. I'm even being brought lunch. And I'm so scared. But I thank God for the lunch. When I just took one spoon, it caused me to puke.
Yeah.
So the pressure caused blood to come out. So I had not even been done a scan to see how my baby was progressing.
Yeah.
I think there was a lot of negligence at that time. So it became an emergency. I was taken to theater very fast. Already I have lost, it was a concealed placenta abruption. The placenta had separated from the uterus.
Yeah.
But then I had placenta previa. So it had blocked the uterus. Blood could not come out. So it was quite a terrifying moment. So I was taken to theater. The baby had already gone. And already I went in shock because my blood levels had gone down.
Okay.
I went in shock. I was transfused. They could not even get
The veins.
the veins, so I was cut. I think it took so long in theater because I remember waking up late in the night. And one of the things that really hit me is that I never saw my baby. When I woke up, the baby had already been taken for burial. So those are the things that we live with, and they're painful. And yes, I thrived through, and I thank God for that.
Yeah. And even before you continue, those are the first two experiences that I can see Dr. nodding.
Yes.
And there are points that you've captured, the rupturing of the placenta, the symptoms that she had. Could you just talk about that briefly before she continues the story?
Yeah,
experience.
I know her story is quite touching.
Yeah.
But yes, I think Becky is actually just showing us exactly what happens with these conditions. It's unfortunate that she's had to go through different scenarios which can actually result from preeclampsia. So first she's had seizures, convulsions. I think that's the extreme end of it.
Okay.
And as she correctly put it, sometimes you're just okay, you are alone in the house. Life is going on as usual, but
abruptly.
It just happened, yeah. So it's something that is quite unpredictable, and it can just occur if the condition is not well controlled. And of course, the extreme end of it is you losing the baby, which unfortunately she's had to go through.
Right.
The second scenario that she described is actually a consequence again of high blood pressure. So what she's describing is sometimes when you have preeclampsia, your pressure may be labile, so they fluctuate quite a lot. So one moment you may be okay, and the other moment things are happening. So in her case, having a rupture, what she's talking about is the placenta separating prematurely.
Okay.
Unfortunately, sometimes we may not see the gush of blood like in her case. The blood is concealed and you go into shock. So I think she's very lucky. I think I agree with you. Your guardian angels actually would like to.
She's had,
but the second scenario that she's describing is actually life-threatening. And unfortunately, if not captured on time, we end up with losses.
Because it was even not treated with
both
urgency.
of the mother and of the baby, because she's describing two conditions here. Her placenta is blocking the way, she's bleeding, she has high blood pressure, she's lost the baby. Quite unfortunate complications of the condition.
What about when she puked, when she vomited? So what's the connection with the blood now coming out?
No, of course, when you are in shock or when you are going to shock, you feel nauseous, and that is some of the things that happen. So I'm sure you may have been feeling hungry, very thirsty, and you want to take something, and the body is not in a state to.
Okay.
So it's she rightly puts it off. When you retch or when you cough or when you vomit, you use a lot of tummy pressure, and that can force things out. And I think, unfortunately, in a case, that is what led to the people around to see that there is actually a problem.
A problem.
Yeah.
It's so unfortunate. All this because of lack of knowledge or negligence. No, really.
I wouldn't be able to. I wasn't there. The story ni tofauti. There are so many factors that come into play, so we cannot make any conclusions to that.
But why would we say there's not enough knowledge about high blood pressure in pregnancies, until now, honestly? Until now.
That's why we're here. I mean, knowledge is only acquired if it is shared. So we're here to share with the lay public so that we know that these conditions actually do exist.
Yes.
And they are serious. You see, there are many war stories. So we have this unfortunate story that we are hearing today. And there are those who are like, pregnancy is just okay. I had many kids, and it's never that serious. So it is trying to demystify such perceptions. And that's why we're here to, I guess, to discuss and share with the lay public. Yeah.
Okay, so after the surgery, I just say that I never saw my baby, and it really hit me. I think it's important for the mother to see the baby for yes. So I was in hospital for about 2 weeks because of the shock and the low blood. I had lost a lot of blood, but I came out of it. Though with blood vision, I could not walk alone. I always needed help, somebody to be around me, to walk with me. So at that point, I was discharged after 2 weeks. And then now I decided to travel to come and stay with my spouse, so for healing. So when we were here, we were in the city. So one of the colleagues to my husband heard our story, and therefore he advised him to see a gynae, Dr. Charles Wasike. He was based in Afya Royal Clinics in Ngong Road. He advised him that he has seen him helping mothers of different conditions. So we decided to seek his intervention. So when I came from that hospital, by the way, we had been advised to wait for 5 years before we conceive. So for 5 years before we can think about conceiving.
Yeah.
And from now, the information I have, I know that as you age, it also, you become more exposed to that. So when we went and visited Dr. Wasike, we gave him the story, and he was like, those are the thoughts of 1960s. Yeah.
Well put.
Yes.
Daktari hapa anajaribu kuwa diplomatic, but that is well put.
Yes. Yeah. He told me that. He told us, provided your body, you are experiencing the natural things that the woman goes through, I will just say that means that you are healed. And therefore, he advised us not to wait for the 5 years. He advised us to start immediately, to look for a baby. That was around 3 months after CS. Serious? Yes. And in fact, to top on it all, he even gave us some fertility drugs.
So you stopped, by the way, you did mention about you stopping the hormonal, what's it called?
Pills.
Pills, exactly. What's the connection between that and high blood pressure in pregnancy, Daktari?
No, the hormonal pills, like those that contain estrogen, can increase the risk
They can.
of having high blood pressure.
Okay.
There's a way in which they interact with the vessels, blood vessels, and that can make you high
Okay.
blood pressure. We discourage, yes.
So is it also theory that those who have undergone CS when delivering should not like conceive almost immediately? Because she was given a different...
I think that's a discussion for another day. Let's concentrate on
we are trying to debunk
because
the myths.
there are many other factors that determine how soon you can conceive.
Okay.
First of all, the reason why the CS was done.
Okay.
And then how you heal. As she correctly said, I mean, if everything is back to normal, then you are good to go. And then what are your desires in the next pregnancy? Do you want to have a CS or do you want to have a normal birth try? So those are the things that will help us determine.
That makes sense.
Yeah.
Okay, sawa. Continue.
Yes,
Becky.
so he gave us a free bill to go on and at least, and he told us, he promised us he will work with us from day one. So that was hope. That was really hope, because I think we were feeling like, this thing, maybe we may never be parents.
Yeah.
Yes, so...
And even before you tried the next one, because I'm really concerned about your emotional wellness at that point, because losing two babies, pregnancies, and you have to go back to work. So what was it like? Because today I was seeing on social media platforms that Germany actually are trying to put up a bill that will offer maternity leave for those who lose their pregnancies. So you had to go back to work immediately. So how was that for you?
Immediately after work, in fact, I was supposed to report after 21 days, but I had to talk to my managers so that they could let me. In fact, I asked them even for unpaid leave because I knew what I was going through. I just wanted to be away from that place.
Yeah.
Yes, so they agreed to give me the days. I stayed away for 3 months.
Okay.
Yes, but it was not unpaid. They paid me.
Wow,
yes.
at least.
Yes. But I can say that a lot of my strength, I also draw it from my spouse. We have a support group, and we have heard stories of mothers whom spouses left because of this condition.
Yes.
And I think my spouse was so close to me. We talked anything, everything at every time. And we also have a circle of friends who are Christians who really supported us also emotionally. I cannot say I went for professional counseling, but just with the people that surrounded me really helped me to walk through the process. Yes,
that makes sense. And I know we are coming back with more of your story as we're going to continue share. Nasikia ni movie. Yani anaongea na shindwa kumwambia wacha tuende break, but we just have to take this short commercial break. We're coming back with more of her story and more of the treatment processes and also just the preventative measures. If we can be able to prevent it, Daktari will shed a light upon it. So remember, this is Health and Wellness. Stay tuned. We'll be right back.
Auditions are open for Kenya's Star Search on Saturday 1st February and Sunday 2nd February at the Nairobi City Hall Charter Hall from 8 a.m. to 5 p.m. Come through and show us what you're made of. Proudly sponsored by
Star Times. Enjoy digital life.
People come to me and they say they get discomfort when they have ice cream. Can you imagine that? Avoiding having cold ice cream. Sensodyne gives you long-lasting protections against sensitivity. And people come in and they're like, oh, it works. I can have ice cream and I'm not in any discomfort. I recommend Sensodyne because it works. It's brilliant.
Animal feed ecosystem in Kenya is quite a tricky one. First of all, we have a deficit of 60%. That means that we are importing majority of our feeds. But that feed that we produce locally, we are losing 46% of it to post-harvest losses. The big question is, how can we turn this narrative around?
If you want to do dairy farming, it's feeds. Number 2 is feeds. Number 3 is feeds. In other words, when you want to do dairy farming, take care of the feeding of your animals. And if you do that, you are good to go.
This is why we are saying there is no other grass in the world that is more vegetative than super napier. Look at this. See? And then very easy for handling.
And this is just how many days old?
This is 60 days, since we cut.
Great yummy taste, gotta hack it. I spread bread, but then go gotta pack it. Napaka nyweki design ya mokoro. Blue Band, Juni natural cocoa. 5 vitamins, una grow plus ni tam nani Tuna hack snack na ki Blue Band choco for your growth.
Najaribu kutengeneza kucha vizuri. Lakini ndefu bado nyoa, lakini mimi naona wewe unataka kujifanya mitoto ya Jamaika. Wewe lisa kwenda Jamaika? Bado.
Nini unafanya? Nini unafanya mtungi yangu?
Wewe naona kama mimi nafanya nini?
Kikia yako inakuanga mzuri nyangumi. Ni mtungi yangu unatoboa. Ikichukua bendera. Ni mkubwa.
Hii ni mateso.
Ni mkubwa. Ikichukua bendera. Bendera ndio hiyo. Silence for national anthem.
Nyamaza mwete.
Welcome back. If you're just joining us, remember this is Health and Wellness. My name is Zaitun Ali, and before the break, we were discussing about high blood pressure in pregnancy, and especially preeclampsia, to be specific, because one of our guests right here, Becky Otelli, is a survivor of preeclampsia, and we also have Daktari, Prof. Sikolia Wanyonyi, an obstetric gynecologist here, and he's shared so much insights. And some of the things that actually, Daktari, you were mentioning about preeclampsia, that it actually occurs 20 weeks during pregnancy. Yeah, you had mentioned that, and from 20 weeks moving forward, and even higher. Yeah, and hearing what Becky was saying about her experience, how was it for you? And what can we actually draw from the experience that you had, because you continue to share, as you continue to share?
I think the experience that I had made me understand that we really need information, knowledge.
Yes.
Not only to mothers, to siblings, to healthcare providers, so that they could understand when there are indications, some specific signs, that they should hold it very strongly and heartily, so that they can help mothers. I know that in my experience, if information was there up to the ground, I could not have lost the 2 babies.
Yeah.
Yes, so I think information and intervention from the healthcare providers, I think continuous sharing of information is very important.
Yes.
And I think as at now with our county governments, counties should have opportunities to train our healthcare providers on this line.
Yeah, even as
just
a
to help mothers.
grassroots.
Yes.
Yeah. And Daktari probably mentioned some risks that we've had the risks for the mom, but what are the risks for the baby during this period?
The risk of high blood pressure to the baby?
Yes.
The commonest are actually, one, it can interfere with the growth of the baby. So even if it is controlled, there are very high chances that the baby will not achieve their desired weight or growth, and that can actually impact on how they perform or develop in future. And of course, the extreme of events is death. They can actually cause death of the baby while in the womb.
And also of the mother?
Yeah, and also actually preeclampsia is linked, or hypertensive disorders are number one cause of death in most low-resource countries. Yeah.
Okay. Yeah. Okay. That it's heavy though, but yeah, we need to discuss about it. And are there medical interventions for?
Yes. Now there's been a lot of interest from the medical world.
Yeah.
All for many years on preeclampsia, and we've made a lot of progress. So first of all, we're able to prevent. So by listening to your story, your past medical history, doing some ultrasound measures, and taking your blood pressure in the initial phases of pregnancy, we can actually be able to institute measures to prevent you from getting preeclampsia. Of course, there are those lifestyle measures that can be adjusted, like weight loss and stopping you abuse of substance that can actually help preconception. But once the condition develops, yes, we should actually, if picked early, we can actually be able to control the blood pressure and push your pregnancy as far as we can get. Yeah.
So for Becky, is it the condition developed already, or what is it exactly?
So in her condition, in the situation, for instance, the first pregnancy, most of the time, unfortunately, we learn from the experiences. So maybe she was very young then, and someone would have said she's not very much at risk, and a lot will have been missed. But there are a few things that may have been picked up, but I don't think they were existing at that particular point in time. But going forward, yes, I'm sure we've had a chat, and she's a proud mother of two children, and I'm sure that happened because someone somewhere was able to put in place preventive measures to help her achieve that full-term pregnancy.
Okay. Yeah. So now fast forward to these two successful pregnancies. So how were they?
Yes, for the two successful pregnancies, we had a preconception clinic with a gyna.
Oh, there's that.
Yes.
So before you conceive, there's.
Yes.
And how many do that?
It's very important.
I know.
Very important. So we worked with him. Immediately we conceived. We continued with him from day one.
Wow.
I went through it very successfully. 2 weeks to my EDD, I developed pressure came. But then that was almost ready. So I just told the doctor, just remove my baby. I don't need to wait anymore. Yes, I don't have to go back to that. So yes, my firstborn was born 2008 in November through CS. Remember 2007, I had a CS, but without a baby. So I can say that God restored. And yes, and that moment now, because I had information that you're not supposed to use the pills for the family planning and all that, we took a lot of caution. And as we were trying on methods of preventing so that we can wait for some time, the baby girl came.
Wow.
Yes.
Wow.
So I conceived, and it was a very difficult pregnancy. Very difficult.
Oh, it was?
Yes.
In terms of?
But we worked with the doctor.
Yeah.
I was on treatment, but at around 6 months, the pressure could not be controlled.
Oh, you developed pressure again.
So you were on pressure meds, Ama? What kind of treatment were you on?
Yes, pressure meds and the aspirin, the junior aspirin.
That's
yes, I was on that.
Yeah.
So it went so high, and I was given some injection to grow the lungs of the baby.
Okay.
So that in case of anything, they could just remove her. So at about 6.5 months, my baby was born. Yes, she was removed. for a CS, 1.3 kgs.
Oh no.
Very
That's a
tiny,
different
but
journey.
she's here, you will see her.
Oh, haiko wapi? Ni ule naona pale?
Yes.
Ah, huyu ni mzima.
2010 April,
Yeah.
she was born.
Okay.
And I had really increased in weight again.
Yeah.
The body was not coming back to normalcy. And everybody who could come thought that I'm still expectant.
Oh,
but the baby
no.
was in the nursery. So I was just feeding her. That time, there were no pumps. Also, you're
Where?
expressing with your fingers.
Yeah.
You go and feed in the nursery. So one day I had gone to the nursery to feed her. Then I just felt wetness on my abdomen. And I wondered what was happening.
Yeah.
So looking at myself, it looks like bloody. So it became an emergency. And I was carried off. We waited, the doctor came, checked, and they were thinking that maybe one of the veins had not maybe been ruptured. That was after 6 days.
Okay.
Okay.
Yeah, so I was told that I will go back to theatre the following day. So it was a weekend. So the doctor who had done the CS was not in. She had traveled. She was an Ethiopian. But she had left a doctor from Aga Khan who was on round. So she had put there that I may go back to theatre if it continues. So the doctor was called from Ethiopia. She took the next flight and came back.
Really?
Yes, she
Oh,
came.
nice.
So in the morning, that night I didn't sleep. I had made up my mind that I'm going back home because I knew I may not make it. So when she came in the morning, she came and checked now. My tummy had come back to normal. There was no more bleeding. Nilikuwa nawekewa theater towels na lower too.
What?
Yes, so when the doctor checked, she told me she did not want to give me any drug to drain I had a lot of water in my body.
Yes.
So she said that because she felt like if she gives me that drug, it will drain even the milk for the baby.
Sure.
So she said she wanted the body to do it naturally. But then it's like it had found a weak place, a weak point to just come out. So the back to theatre was cancelled. That's another victory that happened.
Nice.
Yes, and now going back to the nursery to check on my baby now because after that I was first told bed rest, no walking around.
Yeah.
So the nurses were the ones coming just for the milk and going to feed the baby. But then after that, I'm going to the nursery after I've been now given the just to go. I find my baby now with the NGTs, and I'm wondering now this tiny thing with all these things, what is going on? Yes, but yes, we started now feeding her through the NGT. She gained weight. She gained weight very fast from 1.3 up to 1.7. The doctor told me, I have seen you are able to take care of the baby.
Within how many days?
It was about 4 weeks.
Okay.
Yes. 4 weeks. So we were released from the hospital.
Daktari, that's good progress.
Oh yeah. She's
Okay.
very nice,
Nice.
stories. I mean, sad and with nice endings.
Yes, clearly. Then give us a take home points, insights about what can we do to just watch out towards this. It's a silent killer.
Yep.
Yeah.
Yeah, it is silent in courts, but the thing is that what you need to know is that preeclampsia is prevalent, it's very common among our population. Number one, we can be able to predict it. We can tell you whether it's coming. We can be able to prevent it. And we can be able to treat it. And we can be able to give you good outcomes regardless at various gestational ages, depending on how well you respond. So yes, there is expertise. What we just need to do is to spread it all over the country and make sure that all women have access to it.
And for moms who get twins, multiple babies, is it also sort of a risk factor?
Yes. Sorry, I didn't mention that, but yeah, I think I alluded to it. Yes, twin pregnancies or multiples is a major risk factor because we always say that when you have twins or multiple, then you're increasing your chances of all the complications that we can encounter during pregnancy.
Why?
Yeah. Why? Because good example is, you see, you cannot just wake up one day and go for the marathon, right?
Yes.
You will not make it even 1 kilometer.
Yes.
So that's what happens. You just hear, then you get pregnant. So you can run a few meters, but if you put on more weight, more load to the body, then it can't do it. So body has to adjust. So the more the babies you have, the more the load that the body is encountering, and the more it struggles to adjust. So that's why you find all these complications coming around.
Okay.
Yeah.
And we've majored on preeclampsia so much. So the other ones, the chronic ones,
the outcome is the same. They present the same way.
Yeah.
The cause is the same.
Symptoms.
They may not be as dramatic as the preeclampsia is bad, but the way to go about them is pretty the same.
Those ones can be contained.
The precautions are the same.
Okay.
Yeah, but they remember that if you have hypertension from whatever cause, then it could evolve into preeclampsia.
Oh.
So actually, it is a very major risk factor of it evolving into preeclampsia.
Okay.
And that's why she was on things like junior aspirin that are trying to help her not to go into that condition.
Do those meds have an effect to the baby that you're carrying?
Any meds we give you in pregnancy, we try to give you everything that is safe for the baby, and that's what we call the risk-benefit. So every medicine, like for instance, it will have some side effect.
Yeah.
But does it warrant the risk that you're undertaking? So does it warrant you losing the baby or having a woman bleed or all that? So we weigh that. So relatively safe. Yep.
Okay. And even mentioning about side effects, are there lasting effects that occur after probably like Becky underwent the preeclampsia twice?
Yeah.
So are there lasting effects?
That's a very good question, because we've noticed that patients who've had preeclampsia or hypertension, this is in pregnancy, actually long term, they tend to have increased risk of getting hypertension long term. So you just have proper hypertension, and then other conditions like heart conditions, strokes, and all those kind of things, affecting what we call the cardiovascular system, so affecting the heart and the blood system. So once a woman has had preeclampsia or hypertension in pregnancy, we caution them about that. So they have to watch out their lifestyles in future.
Yes.
They have to make sure that they have regular checks so that they do not suffer these conditions, or if they do, then we can be able to contain them so that their life can be as normal as anyone else.
And even these last two successful ones for Becky, they actually at some point posed as a threat, and the only option was like remove the baby as soon as possible. So is that the only solution to preeclampsia?
Oh, yes. Now, we always say that the treatment for preeclampsia, the effective treatment for preeclampsia is delivery.
What?
So the moment,
even at 6 months?
The moment you remove the baby, that's why at 20 weeks, when the baby came out, unfortunately not alive, but she became well, and she was able to go back to work. So the treatment is remove the baby.
Okay.
But the question is, when? Are you ready to remove the baby when the baby is immature? So we usually balance. You have to really try and push to a level where the baby is mature. If the baby is not mature, then you really have to balance between saving the mother's life
and the baby.
Saving the baby's life. So it's a very delicate balance here. And that's why, as she correctly said, when she reached 38 weeks the other time, what's the point of having all this? Let's get the baby out. The baby is mature. We've tibled the patient.
I like how now you got the information finally ukaitumia as your strength and as your power. And I hope that people also get this as well, because it's actually something that is really affecting pregnant women at the moment. And we've not even touched on the pressure that comes postpartum. So how do we deal with that?
Yes, so there is a small proportion of women. Now, we may say this is maybe an oxymoron, because we say preeclampsia develops during pregnancy. Here I am saying that the treatment is delivery. Then you find someone has delivered, and then we say you've developed preeclampsia. So there's a small proportion of women, due to other factors, will actually develop high blood pressure as the body tries to adjust, so it cannot adjust well. So it's like running the marathon again. A guy can run very well. He does 20 kilometers. But at the last moment, they faint. You get it?
I get
So you're
you.
like, why is this guy faint? And yet he's been on the road for 2 hours. So, and there are those who, after they finish, they'll still continue running and celebrating, lifting the flag and doing all that kind of stuff. So, yes, some women, yes, once you've removed that pregnancy, the body is unable to adjust back to normal well, and that's when you find them now getting hypertension, which again is just as serious. So it can go on up to 6 weeks.
Okay.
And it's just as serious as the one you get during pregnancy.
Okay.
Yeah.
Thank you so much for sharing the insights. Becky, thank you for your amazing story, a very insightful one for that matter. We are glad that God restored at the end of it all. And also thank you for sharing the information. Information is power, guys, and I hope you've heard that. This episode will also go on YouTube at KTN Entertainment, and also find us on our social media platforms at KTN Home _ in case you have any questions. 0759 434389 0759 434389 is our WhatsApp line. Tuambie hapo kwenye mtandao. Lakini also check out Lugo Collections for this amazing fit and all other bespoke suits for ladies and gentlemen. Until next Sunday, my name is Zaitun Ali. See you later.